Monitoring, evaluation, accountability and learning have been identified to be critical metrics of assessing the overall performance of organizations such as NGOs and governmental bodies. Additionally, it helps in evaluating whether a project is achieving its targets and understand the required needs and adjustments. As organizations aim at pursuing successful projects, the demand for its skills has gone up. This program by Humanitarian Global is an introductory course to the MEAL field that seeks to enlighten upcoming MEAL professionals on essential project management skills. Among the covered modules and topics include Introduction to MEAL. The learner will get to learn more about the history of MEAL, what is MEAL, MEAL phases, and the significance of MEAL. In the second module, which is MEAL Planning Part 1, the participant will develop more skills on how to execute learning in MEAL, participatory MEAL and how to develop objectives and indicators. In Module 3, MEAL Planning Part 2, the learner will gather advanced skills in Performance Management Plan, Indicator Performance Tracking Table, Data Flow Map and Summary Evaluation Table. Apply for this course today by visiting our website, www.humanitarianglobal.com for more details. Monitoring, evaluation, accountability and learning is an essential subset of project management. The subset has been identified and proven to be critical in the success of 99% of projects. Funding organizations are increasingly seeking more accountability for the funds they provide to development projects. Therefore, without an effective MEAL system, it would be hard to track progress, discover unplanned effects of programs, make judgments, or determine the impact an undertaken project will have on the target audience. Hence, undertaking this diploma course expertly developed by Humanitarian Global will help you develop advanced skills in this thematic area. These skills are essential in creating a roadmap for implementing project activities as intended. They also aid in conducting monitoring and evaluation activities efficiently and promptly ensuring continuous learning throughout the project cycle. Among the covered modules and topics include Module 1. Design Logic Models. In this first module, the learner gets equipped with hands-on skills on how to create various logic models such as Theory of Change, Results Framework, Logical Framework and M&E Framework. Secondly, MEAL Data Collection. In this module, the participant will develop more knowledge and skills on data sources and data quality, quantitative data collection, qualitative data collection, mixed approach and data management. In the third module, which is MEAL Data Handling, the learner gets to develop hands-on skills on how to conduct quantitative data analysis, qualitative data analysis, data visualization and data interpretation. In the fourth module, which is using MEAL data information, the participant gets to develop more knowledge and skills on MEAL Communication Plan, MEAL Learning Plan, Adaptive Management and MEAL Reporting. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.
Okay, great. So I was taking our participants through the different areas that we tackle, and one of them is training and learning, and this is a broad area that we ensure that we can offer online training programs and online courses to our participants. We also do organize for webinars like the one that we are having today. We also do make sure that we can work with you to train your team, to train your members of the organization. So in case you have that kind of a request, you can always follow up with us, and then we're going to guide you accordingly on how we can come up with the bespoke training program for your team. We also do organize conferences. We also participate in team building and capacity development activities. In addition to that, we do have a pool of experts, like the expert that we're going to be able to interact with today in terms of the different areas that we offer, we handle. And meaning that based on that expertise that we have on our side, you can always feel free to reach out to us, and then we're going to organize on how we can meet you for a session. We can work with you in the capacity of seeking professional advice, consultancy work, and among others. So that means we can always work with you in that capacity. Thirdly, we do have a platform where we promote and champion for humanitarian work, and that means you can always reach out to us and share with us the initiative that you're doing. and that is in regard to also humanitarian resources. So we do have very many resources on our website, and maybe just a quick one that I would like to highlight. We do have a community forum, and this is a community that is trying to bring together humanitarian and development professionals from different parts of the world. So if you're not a member of the community forum, I would urge you as we continue the session, make sure that you can go to our website, and also we'll be sharing a link with you on the chat section so that you can join our community forum. So this is, if you go to the website, there is a tab for community forum. And once you click on that link, you're going to be redirected to a page where you need to sign up. So it's very easy for you to be part of the Humanitarian Global Community Forum. And this is where we get to interact and even share experiences in our humanitarian work. You ask questions, we get to respond to you. Also, other participants, they're going to respond to you. And maybe just a quick highlight. Once you join, you're going to see that we do have various categories. So make sure that you can choose the one that you want to be able to join. So we have, for instance, the meal forum. So once you click on that forum, you're going to see there's a list of topics. So make sure that first of all, you can introduce yourself. It's very easy. Make sure that you can even go through and see the participants of these group or maybe forum, see the introduction there. And that means once you've logged in, you're going to see there's a reply button at the bottom. And then you can, once I sign in, I'll be able to see there's a reply button. And then I can be able to introduce myself. So just a quick overview of this forum. We do discuss great topics, and you can even see we have an ongoing discussion here about baseline in meal, and we have had input from various participants. So that means just come there, join, be able to contribute to our topic, ask your questions, and we are always there to help you and assist you. And when it comes to the session that we're going to have today, as we always say, it's very challenging to handle all the questions within the period that the time frame that we have for the session. So we urge you, be part of this forum in case your question is not responded to during the session. Come and post it here. We assure you, we're going to respond to you. So with that said, I would like also just to highlight some of the areas that we tackle when it comes to training and learning. And apart from meal, which we're going to be handling today, we also do train on water sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal, infant, and young child nutrition. And also we have other upcoming areas which include public health, project planning and management, gender-based violence, data analysis, child protection, climate change, and also humanitarian principles and essentials. So that means we do handle a couple of areas, and we urge you to always visit our website, follow up with the areas that you want to build your capacity in. And this is just an overview of the kind of training that we offer to our participants. So what you're going to experience today, it's just a small fraction of the magnitude of our training when it comes to training you. And that means always feel free to reach out to us, talk to us in the chat section, so that we can guide you further on how you're going to be part of further training and also certifications. So I would like to say that because we do see this kind of question severally, and that is, do you offer certificates for these for attending this event? So the answer is no, because this being a free event, we want to also interact with you. We want to learn from you. We want to have a session that we can interact together. However, if you're interested in further training and also getting a certificate, you can follow up with our paid program. They are very subsidized. We have discounts, especially for you participants who are part of this meeting. So always feel free to interact with us on the chat section. And as I wind up, I would also want to clarify and say that we already have your details. So there's no need for you to share your personal details on the chat section. As you have always seen, and I know most of us have been following up with us since the first day, we normally do share these slides and also the recorded version immediately after the session. If not, you can also go back to the website. Once you go back to the website, there's a link for, you're going to find there's a link for YouTube channel. So once you go to the YouTube channel, that's where you can find all the sessions. And it's not only meal, also including the other areas. all the past webinars that we've done, you can always have an access to them. So thank you so much, and we look forward to a very interactive moment with you as we tackle the topic of the day. And now back to you, Eric.
Thank you for that, Anthony. Thank you for the wonderful introduction. And with me also, I have Winnie Moya, our key speaker for the day. Winnie, I hope you can hear me.
Yes, I can hear you. Can you hear me?
Yes, I can hear you, Winnie. Maybe you can start by introducing yourself, then you can carry the session for the day.
Okay, thanks, Eric, and thanks, Anthony. Good morning, everybody. My name is Winnie Moya. I am a male professional and have been in the field for over 8 years now. I have experience working with NGOs and also conducting consultancies for various donors in the area of meals. So that's monitoring, evaluation, accountability, and learning. And I'm really passionate about it, and I'm hoping that it's going to be a good session. Thank you.
That is okay, Winnie. I think we may proceed.
Great. I'm going to just share my screen shortly. And in case of any questions, I think they can place them in the Q&A session and then section, and then we'll get to that at the end of my presentation. Eric, let me know if you can see my screen.
Yes, I can see your screen, Winnie.
Okay, perfect. Thanks, Eric. So today's topic is about setting up of a feedback and reporting mechanism. So this falls under the A of meals of accountability, where we're talking about accountability to the community, essentially. So this area is a little bit wide, so we're going to have 2 sessions on the same. So today we'll start with the first part. And the main sections that we're going to tackle today are what is this feedback response mechanism, as shortened as FRM. Why is it necessary to have it? The different types of the FRMs and the steps in setting up the FRMs. So by today, we should cover up to a few types of the FRMs, and then for the next session, we'll cover the last section. So what is a feedback and response mechanism? We can break this down first by talking about what is feedback. And feedback can be both negative or positive. It's essentially a statement of opinion, which is subjective, of course, from the person who is contributing it. And so it can be in the form of a question, a query on either the programming or behavior of staff or partners, or whoever is conducting a certain project, in this case, in either humanitarian or development sector. And then this statement is given for, it's a consideration, they require some action from it. So it could be a comment which just requires to be acknowledged, or it could be a query, for example, why have I not been enlisted as part of the beneficiaries for, the cash voucher project, or, any other activity that is being conducted. And so it's given essentially to the staff of the implementing partner organization. So this can be an international NGO or a local NGO or any other partner. And then they have to proceed and give the actions or how they're going to address these comments. So given that it's negative or positive, complaints is a type of feedback. And sometimes this FRM is also called a complaints and feedback response mechanism. So it's more or less the same thing. It's only that complaints are a type of feedback because it's a negative feedback. However, we should note this as it should be recorded as a type of feedback, not necessarily like slotted in differently, because once you're given positive feedback, you still record it. Once you're given negative feedback, you record it and acknowledge it, and then respond to it and note it. So the mechanism, the feedback mechanism now, is the overall system. So that includes like the way that you're going to process these opinions or queries that you receive, how you're going to provide now these actions or feedback again back to the community, because it's a loop. Remember, you are you here. I'm going to have the assumption that we are all working with a certain stakeholder, and so we are the ones receiving the feedback. And closing the loop means that once you receive the feedback, you address the feedback, whether it's internally as an organization. So for example, if the complaint is on a staff member who maybe had there's something that went wrong in the project, and this is of course a subjective opinion of a community member, we can deal with the issue internally in the organization and have some disciplinary actions. And then after that, we close the loop by going back to the community member if we can actually identify the person or make it known that we have already done our disciplinary measures. There's no need sometimes to go into the complete details. If the person no longer works with you, of course, this should be explicitly said. But if you do have a whole disciplinary process, which is internal, this can just be communicated in summary, but it's important to make sure that we have communicated what has been done, and where there are issues such as queries such as why have I not been included in certain lists, you still communicate that there are certain criteria, both inclusion and exclusion criteria, that are used to form these lists, and why certain community members have been chosen as beneficiaries and others have not. And so it's also about a matter of communication and being explicit about the type of support that the project is bringing to the community, and not giving false promises, because this is very detrimental. And also we need to make sure that the community can trust us and that we are keeping to our word and that we are serving them, and they are really the heart of our projects. So for this system to work, we also have to include multiple channels, because remember, we are serving community members who are also very different. We have the young, the old, we have male, female, we have those who have different levels of disabilities or vulnerabilities, those who are marginalized or minority communities. And so we need to make sure that we are inclusive in the types of feedback that, in the modes in which they can provide to us feedback. So I hope that is clear, because it's really important to understand that as the basis. Then once we need to also understand why we need to give this. Okay, I think I'll just restart again. So why FRM? So the first point is on the core humanitarian standards. So the feedback and response mechanism, or rather, so it's part of commitment 4 and 5. The core humanitarian standards are 9 commitments that are sort of guidelines for humanitarian and development actors, and they seek to ensure that we have improved the quality of assistance. So they serve different purposes, each of them, and the main thing about these commitments is that they place the community as the central part of any humanitarian action. And so that means that anything that we do, we have to involve the community, and that community participation in each and every way is very essential for us to have sustainability and also impactful projects. So commitment 4 and 5 talk about ensuring that we are, commitment 4 is on the community knowing that they have rights to seek for information about any issues that affect them. So this information is sought from these organizations that are supporting them. So that those are the NGOs. And then commitment 5 is on access to safe and responsive mechanisms of handling complaints. So those two are really crucial, and that's already the commitment that is there that we have to ascribe to. And secondly, and which is interlinked to this, is that we are accountable. We have to be accountable to the community, and the only way which they can also hold us accountable is to say that they gave this feedback to us, whether it was a complaint or a compliment, and this is recorded at a certain time, and so they can also be able to measure the effectiveness of the project to see if there's been any action which has been taken since the time of lodging their complaint, mostly for complaints, but also for them to be able to know how they can address us in case of anything. So this could be about the project or even externally about something that has happened, an occurrence, and knowing that this organization is working in this area, they can always be able to reach us through a certain avenue. Thirdly, which I've already alluded to, is understanding better the effectiveness of the project implementation and improve the quality, which is tied to the SCORE humanitarian standards and also this feedback. 4 is we are able to reduce harm to the community by having these feedback systems, and this includes children. So children should also be included in this feedback mechanism, in that we need to make sure that they know that they can access the organization and they have the right to give complaints and compliments about anything that is occurring around them. So once they feel safe with whichever mechanism, they should be able to access it, and this should be taken as feedback. There shouldn't be any segregation in terms of saying that you override the child's voice and use what the adults say. It should be equal in terms of what we receive from the community, and even ensuring that they're able to access these truths, especially children of varied ages. There could be the adolescents and the older children are able to actually communicate a little bit more eloquently. It could be in different languages, but they're better able to express themselves. But there are those younger ones around younger than 7 or 5 who may not necessarily be able to give a whole coherent story, but they are able to communicate in different ways. And so we need to make sure that even the types of feedback are inclusive in this regard. And then number 5 is once we have feedback mechanisms, we are able to reduce risks of fraud and inefficient use of funds, because remember, we are accountable. We are able to, the community is able to hold us accountable, and we have already communicated, for instance, if the project is going to provide water tracking, and we have already explicitly said that there would be X number of trucks, and they could be coming around in X number of days in the period of the project, which could be 6 months or so. And so it's, the community knows and they are aware, and they will definitely be there to see that that is what is done. And if not, why, and we have to address these questions. And remember also this, the whole feedback mechanism is also included in reporting back to the donor, because these funds are also gotten from the donor, and they want to also see what is the progress of the implementation and how effective it has been. Maybe what are the complaints, what are the areas where we could improve on. So this all ties up into the feedback mechanism. So getting now into the different types of ways which we can provide this feedback. There are quite a number. Forgive there's the numbering, but should continue up to 7. So this there could be more than this, but these are like the main types and channels which we are going to tackle. Today we'll look at number 1 to 4, and then we can continue in the next part, just because they are also quite broad, and we would also like to cover both their strengths and weaknesses. So there's the telephone lines, also called hotlines. Sometimes there are help desks, feedback boxes or suggestion boxes. There's the focus group discussions, which we've also highlighted in the data collection webinar, community feedback mechanism, meetings, and voice recorders, and social media. So each of these, as you already may understand, are used for different purposes, but here we are talking about how we seek feedback from the community. That is going to be the main focus. So we'll get right into it and start with the telephone lines or the hotlines. So a hotline is essentially a phone number that you can call and ask questions, or you can request information, and you share your concerns or feedback. So sometimes this is a number that is, nationally used in a country. So this could be adapted in the organization. But then remember, when it's also used in the whole country, there could be the risk of the complaints may not be addressed in a manner of by the project, which is particularly serving this area. It could be a holistic approach to it. But then on the other hand, it also depends on the resource of the project for them to be able to get, a phone number and also a dedicated human resources person to be able to stand by and be there to seek the calls, because there are times when this hotline is supposed to be open 24/7. So that means you need to make sure that there's the human resource personnel who are there to record those complaints, and they are also able to, put it down, whether it's in a system, in a data entry system, and make sure this is also fed to the persons who are supposed to respond to the complaints or the feedback. So you could also now have the specific numbers for the different program areas, or even like an NGO can have their own hotline number. And usually just key characteristics of this number is supposed to be easy to remember, especially, in these marginalized areas and communities where there are low literacy rates. It's important to make it very easy, and also it should be printed out and publicized so that people know anywhere and anytime that they are able to call this number. We'll get to it, but essentially this will work great where there's good network, but it's important to still make sure that the information is broadcasted about this communication channel. And of essence is also that the people who handle it are mainly the meal team, or you could have, for instance, if it's a child protection or child safeguarding project, you could have the child safeguarding as the focal person, or especially where it's sensitive issues, or if it's also a gender-based violence project, because this is very sensitive. It's important to have the entrusted person is the key contact person. But as I've said, it depends with the human resource capacity as well. So you can have the meal team, and then they can channel it to the focal person. So whether it's a child safeguarding issue or the gender GBV issue, they can channel it to them, and then they can provide the feedback back to the person if the person has left their contact details. So we can speak to the strengths of these telephone lines or hotlines. One is that people can call anytime. Sometimes, often it's usually within working hours, because as I've stated, unless it's a national hotline, normally it's difficult to have someone on call 24/7. There are times when it's possible. However, it should be very explicit even in your communication that the number is reachable at which hours. And so remember even to keep in mind that these community members could be having troubles at night, or early in the morning, maybe before the working hours. So it's important this is also discussed before implementing this as one of your feedback mechanism, or the type of feedback to receive. So secondly, any type of feedback and concern can be raised through this channel. So it's not, it doesn't have any limitation. It's just like a phone call. So if you make a phone call, you can talk about any issues that you may have. So sometimes there could be even issues that are outside the programmatic issues that are served by that particular NGO. There could be concerns in the community, or even just comments, compliments on what has been going well, what has been working well. There could be even some government projects which they're just giving some feedback on. But this is still important because it also serves as a guide to needs that have been met, and also areas where probably maybe we had overlooked as an organization, and that, you know, another organization has jumped in. Because remember, sometimes in the community there could be not a very clear understanding of who is doing what as the name of the different NGOs, but this feedback which is received could be cross-cutting, and so it's important to always record and acknowledge that. Then another strength is that through the telephone line, and they can decide that they don't want to be to give any information about where exactly they are, so they cannot be traceable. Their name, they can choose to not give their name because this is voluntary. For the person who is on the other side of the line, the NGO staff, what their primary function is to make sure that the person feels safe enough to give the information. And once they make the phone call, sometimes it could be times of distress, and therefore it's important to hear out the person. And then afterwards, you can ask whether they want to give their contact details for them to be contacted afterwards, in terms of their phone number or their where they live particularly, so that you can also even assign someone to go physically and, you know, take forward the issue and, you know, close the loop, or they can choose to remain anonymous as part of their rights. So another strength is that the hotlines can be used by any community member. So this could be beneficiaries, non-beneficiaries, even children who are able to access a sort of feedback or even a request for any information or share their concerns. So it doesn't limit anybody as long as they're in that area. And even if they may not necessarily be living in that locality, they may have knowledge of issues which are ongoing there. So for example, it could be a relative of someone who has been having a hard time, maybe they did not receive some food supplies, and that, you know, they're malnourished, or, you know, their children may be in hospital. And so this relative may be calling from a different area, but they know the situation and they are seeking for support or seeking assistance and information from the organization if they are able to support that person who is now in the community. And of course, now even illiterate people can use this hotline, because all they have to do is to have someone near them to dial the number. They don't even have to dial the number themselves. As long as they know the number, they can, you know, have it written down on paper or anywhere, and have someone, they could even use someone else speak themselves, and then use also any language that they're comfortable with, and relay the information that they would like to be, you know, heard either, or the questions that they have. Then lastly, we have the hotlines are also accessible for people who have access to a phone but may have difficulty in mobility. So they may be having a young child, or they may be unwell, or maybe they may have some sort of disability, but they're able to call. They may have access to a phone, not necessarily theirs again. So they're able to still channel the issues that they may have. So the scope of the different types of people who can be able to use these hotlines or telephone lines. So these are also just some of the strengths. Can't cover all of them, but these are the main strengths that we can think about when we talk about hotlines. We can move to the weaknesses now where we have one, children may not really have access to phones, especially younger children. As I mentioned in the beginning, you know, the different groups in terms of like the age groups of children. There are those who are older who may have access to phones and they have ways to even access them. They can go into town or they have friends. But the younger ones, especially those in marginalized groups or communities where, you know, they're very vulnerable and they may not have even a phone in a household, they may not be able to access a phone or use this particular method. So we need to keep that into consideration depending on the context. Then, of course, this is also less effective in contexts where there's low network. So because this is phone, this is, you know, we are using the cellular network, not the internet. So that means that areas which are really remote, there are issues of internet, or there are issues where, you know, it may be unstable, and so the person on the other end might not hear clearly the whole issue, and this may also limit the effectiveness of them responding to this or responding to the concerns that they may have. And also, secondly, the access to mobile phones could be limited to certain groups. So, for example, in some patriarchal societies, you know, the women do not have phones, or they cannot use the phones of the men in the household, and so they're not able. They're also very afraid to even use this type of mechanism. However, now the men in those areas can easily use this for feedback. So that's why in the beginning I said we need to make sure that we have a mix of the different types of feedback mechanisms, because you may find like some marginalize others, and it's important to have a holistic view of the community and ensure that we have captured everybody. Thirdly, we have there could be issues of the staff who's operating the hotline being unable to speak some multiple different languages. When especially we are using, for example, like the national hotline, you could be channeled to the different languages as per the different language that you want to use, but this is mostly also limited to the national languages. And sometimes it's, you know, the person who's speaking maybe could use some form of a broken language due to, you know, lower levels of literacy, or just, you know, because of comprehension, different elements. And so the person who is receiving the feedback is not able to, you know, clearly understand and also answer to these concerns. So this also is tied into an issue of having adequate human resource. Of course, when you're in a context where you do understand the language, it would be appropriate to have a person from the local community to be part of the team. However, sometimes it's not always possible because there are issues of also they may not be trained, and this takes time. And sometimes you need to set up these mechanisms early on because there could be sensitive issues that you need to be addressed through one of the ways of the feedback mechanisms. So it becomes a little bit complicated. There's no foolproof solution because it depends on the human resources, and sometimes you could have now a mix of the different types of feedback so that they can be able to somewhat find a way to channel their feedback. So maybe they could be better if they're able to, if they have some sort of literacy, they'll be able to write this down in their language, and then this in the project office, you could find someone to translate, and then this can be channeled. But then of course there's also the issues of sensitivity, where it's issues of especially child safeguarding and GBV or any other private matter, because we need to respect these issues. But it's something to think about even when you're setting up these mechanisms. And then another weakness is that we always need to get a little bit more feedback when someone calls on the phone. So that means it's a little bit more time consuming in terms of having that two-way communication. So the NGO staff may want to seek clarification and to understand the issue completely. So they may also ask for some backstory. So for example, if we are calling about a child who has not received an immunization, for example, you may ask about the age of the child, if there are any other children who have not received immunization in the household, and when was the last time that they went to a clinic? Is it that they didn't receive that in a clinic, or what are the gaps? So it's important to have the holistic approach, so that even when you're solving this particular problem, you're able to also serve the entire household at the same time, if the issue is also concerning any other person in that household, or even any other issues which could be related to that. So it may not necessarily be immunization. There could be other children who are sick or have not received, have not even gone to the clinic at all since birth, or it could also be the mother. So these are all interlinked, and it's important to have this as the follow-up, because you as the NGO staff are the one who has more information and you understand better programming, rather than the community member who at this point is a vulnerable person who is seeking for support and help. And then if again, another weakness is that if no one answers the hotline, the communities can lose their trust in both the organization and also in this mechanism. So they might call once or twice and feel that if the hotline, for example, if there's someone already calling at the time and the line is busy, they may decide to call again. And if that happens twice, they might give up and say, this is not effective. They're not able to reach you. And for them, probably that would be the channel that they really would use. But because of this, this time that they were not able to reach the organization, they may give a negative feedback. And of course, this will now be communicated to another community member, and it has a ripple effect of also trust in the support that they are going to receive from this organization. And so it's also important to make sure that even if we're able to get this feedback, it's important to go back to the community and make them aware of the different channels, if they feel safe to also use the other channels, and also to be able to have a rapport with them, because once you already have a rapport, even before when you're starting the project at the baseline, being able to work with them concurrently, you can always have champions in the community, or people who are always in the community, volunteers working for you, and who are able to also informally collect this feedback and get it back to the organization. And so there's already some communication. It might not have been directly by the person who is having an issue, but they could have spoken to their friend about it, and then this, that channel has trickled to one of the staff members. Then lastly, there could be little or no oversight of the staff who are actually manning this hotline in regards to providing accurate and appropriate information, and also recording the feedback, which, as I've highlighted, is very important. So once the person who is charged with being responsible for this hotline does not record, firstly, the feedback, we are not able to monitor, so that it loses the effectiveness. Remember when we talked about here why FRM, we're talking about we are better able to understand better the effectiveness of the project implementation. But if we don't have the records, we are not able to improve or see what the effectiveness is. Again, even number 4, we are not able to reduce the harm because we've not recorded. So we are not able to say, okay, these are the number of complaints that were there about maybe harming children in different ways. It could be neglect or abuse. We can trace that we have reduced this through having awareness programs, etc, etc. But if we don't have records, we are not able to actually address this. And also now providing accurate and appropriate information. That means we also need the person, the staff. So if it's a male person who is in charge of this hotline, the person also needs to be accountable to someone, and the person needs to make sure, the person who he or she is accountable to needs to make sure that they step in and always see that they're providing the correct information. And then again, you can also have two staff instead of only having one staff, because this can also overwork a person, especially in crisis, in times of crisis, and in times of where there's a lot of complaints coming in. At the same time, you can just make sure that not one staff is overwhelmed about this, or have them share responsibilities in terms of recording the feedback. They can have like a notebook, and then someone else can help them with the data entry and have a way of channeling this to now the responsible persons. Great. Okay, I think that's it on telephone lines. I hope that's clear. We can move to help desks. So a help desk is essentially just a physical desk that is set up in a project or a program activity where people in the community can share their feedback or concerns and also ask for information. So this usually happens, it could be in most times it's in a central area. So it could be somewhere where it's near a health facility or near a school or near, a communal area where anyone can access. So by anyone, I mean, all the types, all the different people in the community, whether they're old, young, or have some sort of disability, or the different age groups, and those illiterate and those literate. So they should be able to know where this help desk is set up. And it should be very clear in terms of, for example, you can have like a banner or a poster, just a sort of signage, some sort of information and communication on who is this organization, what is the project or program activity that you are conducting in that community, and the duration of that project activity. And then the rest of the information, you can always give it verbally. Of course, now this also depends on the literacy rates. You can decide to also give out brochures or any other excuse me, information material after they come to the help desk, or even in different areas, so that all the people who are physically able to come to the help desk can come to the help desk and are aware that that desk is only manned by staff from that particular NGO. So the important thing to highlight here is branding. So I'm sure like most of you have seen, like there are various colors which are for various different NGOs. So for example, it could be your NGO is known to have a blue t-shirts, and then you have the logo of the NGO in maybe one corner of the t-shirt, or the name in a large print. So that's an identification, and that's really important and very key, especially for this help desk, because the person, even when you're not seated, for example, maybe you're walking towards the desk in the morning or during your lunch hour break, a person can always see that color or that logo and the emblem, and be able to identify you with that organization and give you the feedback. So we have, of course, again, other strengths and weaknesses with this particular type of feedback. So one of the strengths is that it accommodates all types of feedbacks and concerns, because the people are able to come physically, and they can explain and elaborate, as much as they have, concern on a particular issue. So they could tell you even a story of the history of the issue. Maybe it could be stemming from when the project started, or maybe it could be a new issue that just arose, and you're always able to listen and also have questions, follow-up questions as the staff in charge. Of course, now again, we also have illiterate people can use the help desks. As I've said, this desk should be somewhere where it's very well known. But for the illiterate, especially, all they need to do is just express themselves. They just need to present themselves and express themselves. And so this is just in a verbal format, and they just need to be listened to. Then also it's an opportunity to always solicit for more feedback, because many people prefer having the face-to-face, especially in these communities where there's high illiteracy rates, and also there's just a preference of being listened to physically. In marginalized communities and vulnerable communities, they do have this attachment to this, and so it's important to always take advantage of that, so you're able to interact directly with the community. And it's an opportunity to also give more information about what the community is doing, or even when sometimes they do give you feedback on what another organization is doing or other stakeholders are doing. It's important to also clarify to them, you always treat them as humans respectfully, and be able to explain to them. And sometimes this can also just be helpful in terms of insight for them, for the community members, and they can be also able to channel their feedback appropriately. It could be issues that, for example, you completely do not deal with, but of course you will have your own way of channeling this to the organization. But it's, in terms of information, it's having the help desk is a platform where you can always give more information about what you're doing and what you're not doing. Because as we all know, there are some issues. For example, there are organizations which deal strictly with issues of older people in the community, and there are other NGOs which only deal with children or women. And so the community members may not necessarily know the difference, but this is an opportunity to give them the information. The other point is that, as we've said, it's that it allows for two-way communication. So of course, you can be able to address some of the issues there and then. So for example, in terms of now, even like the scope of work, they may ask for support in some areas where it's not covered by the project completely, and you know that, so you do not even need to actually go back to the office and seek clarification, especially for projects where you already know the donor is not flexible and it's very narrow in scope. So you're able to communicate this. Of course, it's now also a matter of knowing how to communicate to the person, because you should not be rude or abrasive to the community members, because remember, they're also human, and it's just important to be sensitive about this. So you can close some concerns there and then, and also note them down as closed. And of course, give more information in terms of the areas where you are able to support, and who is also being supported in those particular areas. If the project is already ongoing, or if it's at closeout stage, you can always seek for information about where else the organization can support the community members. And then lastly, it also allows for immediate referrals of sensitive feedback. So sensitive feedback in this case refers to mostly issues to deal with child safeguarding, maybe safety of children and women. There could be gender-based issues, or even men. There could be issues of the male gender being unsafe in their homes, or in their schools, or in their workplaces, in different contexts. So this could be issues that need to be dealt with immediately, and you could actually receive this information from the victim, and you should be able to know what are the referral steps. There are always those steps beforehand. If your organization is not the one who does those, it's important to know how you can channel this in these challenges or these sensitive issues to the right people, and also to, if it's to the hospitals, to the clinics, it's important to know and have this, you have these contact details, and you're able to, support the person, especially when the person is distressed. you need to ensure that you calm them down and you're able to support them immediately. And also, one thing I didn't note about, I had forgotten to mention on the help desk is it's important that the help desk is manned by both male and a female person, because when it comes to especially these sensitive issues, it could be a woman, but the woman may not feel that they can open up when a man is there. And so the female staff can be able to take her to a place where it's a little bit secluded, make sure she's a little bit more calm, and then she can narrate her story or the ordeal that she has undergone. And then from there, you're able to effectively refer her to the person who can give her the immediate support that she needs. Okay. So some weaknesses also on the help desks is that one, it's an irregular form of feedback, because it's only there when the project is in that area or when you set up the help desk. So you can only receive the information when you're physically there. That means that there could be times that the community comes and they see the desk, maybe your banner is still there or the posters, but there's no one who's manning the desk, and they may feel that they've walked for 3 hours in the scorching sun. And we've talked about also losing trust. This could be also another area where they may start losing trust. They may not necessarily understand the concept of the desk being open at certain hours. For them, they know that this is an area where they can channel their issues. And so from there, they may not be able to even know any other place that they can turn to, unless it's, there's a way that you've also indicated for them to come back or to go to the office, the project office, if it's nearby, or whoever, another person to contact at feedback channel. Then secondly, it's also less easily accessible for people with mobility challenges, as much as it's in a central area and it's in an area where the community members often pass through or congregate. People with disabilities, especially mobility challenges, could still be locked out of this, especially those who are quite far in a distance area and they're not able to be supported by their household members to reach the place. Then thirdly, it requires people who have, for people to come to the help desk in
it seems Winnie is experiencing some technical issues. Gonna give her 2 minutes. But for those of you asking about the slides and the recording for the day, yes, we assure you that we are going to send them by close of business tomorrow. We have your emails with us, and those are the same emails we are going to use to send them. For those asking about certificates, unfortunately, this being a free event, we do not offer any certificate. However, we encourage you to join one of our many training programs. So far, we have a meal monitoring evaluation, we have water sanitation hygiene, we have disaster risk management, food security and nutrition, we have human nutrition dietetics, amongst others. You can inquire depending on the course you would like through the Q&A, and our team will reach out to assist you to join. Winnie, I think you are back. I hope you can hear me.
Hi, Eric. Yes, I can hear you. Can you hear me?
Yes, I can hear you.
Okay, great. Apologies for that again.
Okay.
Let me just reshare my screen.
Okay. As Winnie gets to share her screen, we still encourage you to keep sending in the questions to the Q&A, and this may be questions about our session today or about Humanitarian Global, and we look forward to the questions.
Can you see my screen, Eric?
Yes, I can see your screen.
Okay, great. Thank you. I think I was on point 3. Yes, so the third weakness here is that the help desk requires people to come to the physical desk in person. Therefore, this means that the community member could be recognizable. And so they could feel some sort of reluctance to this because there's limited anonymity. Of course, when the person comes, we as the NGO staff or the person who is receiving this feedback will keep him or her anonymized, and the information is confidential. However, their feeling could be different. So that means that they could be less uncomfortable. So it's a matter of assurance to the people once they come that it's important to reiterate that this information is going to be between the organization and them, and also just between you and the person, and that you're there to make sure that they feel safe and heard. And of course, now it's seeing that can also help the person to also open up a little bit better. And once they see, even when you close the feedback, they feel supported, and they feel that this issue was not even relayed to anyone else in the community, the trust increases, and they can also be able to advise other community members to use the same channel, or even just use any channel that they're comfortable with, because they feel that this particular NGO is able to address their issues with confidentiality and anonymity. So there's no fear of victimization or stigma through using this channel. Then number 4, we have people that's community members may think that the staff who are running the help desk are also the people who are implementing the activities. So that means that they could be biased in receiving the feedback. It's important to give this information in terms of for the people to understand that these are also 2 different things. The project staff, sometimes they may not be able to identify them by virtue of their face, but as I've said, the branding is associated with certain activities in the community, and there could be an issue of a particular staff maybe did some sort of misconduct during the program activity. So that means that the community member, for instance, may want to report an issue that occurred during an activity. So for example, if it was a distribution activity for non-food items, such as like buckets, maybe the staff member went into people's houses, which is not appropriate. This should be done, in open, in a public place at a certain specified time. And it should be information that is also provided to the community members, not just like going into certain houses and providing them with the buckets. So this could be an issue that the community members want to raise, but once they see the staff there, they might feel that they could be those staff that they want to report to. So once you receive the staff, it's important to also tell them that they are open to give you feedback about anyone or anything regarding that organization. They may not differentiate the different departments, but once they understand that all feedback is welcome and all concerns are welcome, they may have like a different way of explaining. They may not know the name of the staff, but they may say this and this happened during this time, and from there you're able to deduce, for example, who were the staff members who were involved at that time, and this can be taken back to the management, and they could be the ones who are now able to deal with this particular issue. Then there could be issues of children and adolescents being hesitant to use these help desks if they don't know the staff who are operating it. So some people require some familiarity for safety, because especially like, children who are of school going age trust like their teachers and their parents, people who they often have interaction with. And so sometimes there are times, not all times maybe, but there are times when they may not feel comfortable enough to report an issue. So it's also a matter of how this is presented and making sure that the environment is also welcoming to children and adolescents. You could find that sometimes they may come jokingly and give just some jokes in the first time, the second time. By the third time, when there's some sort of rapport, when there's, they feel that, okay, you listen to them and you interact with them, they can actually give and come and give the feedback that they wanted, and they were maybe a little bit shy or reluctant to. But yeah, it's important to, be open and be, listen to them, listen to the children. They have a voice, they have the right to also give the feedback, and creating that safe environment is the most important for any stakeholder, not only children and adolescents, but more so for them, because they could be really suffering in silence, and their parents could maybe not bring these issues forward, especially when it comes to issues of abuse, whether it's physical abuse, emotional abuse, or different kinds of abuse. The victim could be the ones who have to come forward for something to be done. Okay, then sometimes it's also difficult to have the staff with the local language knowledge. We also covered this again in the issue of the telephone lines, or there could be issues of knowing sign language for persons who may have certain disabilities. And so it's important to understand the context beforehand. It's important to make sure that you have maybe a translator on hand, or someone who comes in from time to time who understands the local language, who is able to interpret and also support as part of the staff of the organization. Though this may not be, always feasible, but it's important to just have that as a contingency, and also a measure, an area where you can always call upon them, and they could be somewhere on standby. They could maybe just be part-time staff who can support this help desk facilities from time to time, maybe in certain days or certain hours of the day. So lastly, of course, now even regarding now this human resource, it's going to be resource intensive. So it requires at least 2 staff members, male and female, as we've mentioned, especially because of the sensitive issues, and some areas where the gender is different genders always feel comfortable with maybe their own gender, or vice versa, or the other way around maybe. But even in that case, also it's important to have 2, because at the same time, one is able to listen and engage in the conversation, while the other one can take notes and document and record this, because as we said, also recording is very important, so that we are able to address and also note what is our progress on these particular issues that have been raised. Right, so we're moving on to now feedback boxes. So feedback boxes are also called suggestion boxes or complaints box. It's a physical box of any size. Usually the size is just determined by the need, the organization. Certain organizations could have standards of the size of the box. And then it's just, it should be in an area where people can access, and they can drop their written suggestions, queries, concerns, or feedback in the written form. So sometimes we have temporary feedback boxes. So it could be because of a certain programmatic activity, so such as a training or a distribution, which is not a long-term activity. So this could be maybe for a week or 2 weeks, and then you collect the feedback, and then you can address it and report back where you can, if the information is given to report back. So some places where you can place these feedback boxes include like schools, health clinics, or spaces such as like child-friendly spaces or temporary learning spaces. There are also some women and girl-friendly spaces as well, sometimes which are in communities, or lactating areas, breastfeeding rooms, or any other central locations, for example, like outside a building. It should be a place where it's accessible, but at the same time, there's some there's some element of like it's not where everyone really can see you when you're putting in the feedback box. So for example, like in a school, it shouldn't be like at the front of the school where everyone is passing at any time and they can just see you dropping, because now that also limits the excuse me, it limits your able to trust that no one will actually see you doing it, or you don't want to be traced to be the person who's giving that feedback. You really want to feel that it's going to be anonymous and confidential to you. The same for health clinics. So it should be in a room, of course, not in a private room where it's locked and someone cannot access, but it's in a room where someone can, you're the only person who can go like at a time. So it could be in an open area. So for example, like in a school, you could use a room which is not usually closed. It could be a dining room, or any other room which you can just make sure that the community or the children or whoever is participating also should be the ones to say where they feel more comfortable with. Or you can even seek for feedback. You can do like a survey and find out what works best, because you want to make sure that you're placing it in somewhere where it will be used. It's still somewhere central, but it's somewhere where the person can write at that point, like they can write down just next to the suggestion box and drop it there, or they can decide to write down the issue in their own private place, home, or any other room, and then come and just drop it. But the point is to just make sure that it's accessible for everyone and they feel safe. And so it's an area that can be used by all. So include also the different disabilities. It could be someone with mobility issues should be able to access that particular place. And that will also guide the size of the box. In terms of the box should also be locked at all times. It should be lockable, and the only person with the key or to be able to remove it from there is the meal focal person. And that should also be information that is explicitly said to, whether if it's in a school, this should be said in a, to the whole forum, to the whole school, to both the teachers and the students should know that this facility is only brought by this organization. Or if you're using suggestion boxes that are already in the school, to still have that communication so that the children don't feel that the teachers can already identify them, because the teachers already know the handwriting, for example. And also remember, even the teachers themselves could want to give feedback. So it's important to have the organization be the only ones with the mandate to open these feedback boxes, and then you, of course, assign a day to open these boxes and respond to these issues. On that note, actually, the feedback boxes should, especially for schools and health clinics, should be open it shouldn't reach a whole 7 days, a whole week, because there could be sensitive issues of child safeguarding, issues of abuse, issues of rape, which could have written down and not attended to at the right time. So it should be like maybe every other day where it's feasible. So it's important, even before you set up these mechanisms, you understand that this should be the routine that the meal staff, or if it's the child safeguarding staff, going to be opening these particular boxes. They should be able to access them at these times. And then you have also plans for when these people are on leave, or they may be going for certain breaks, such as maternity breaks, or maybe they have some study leave. there needs to be plans of who else is going to now take up that particular duty, but essentially it should be one person as the custodian of the key of those feedback boxes. And then also just lastly, on the size of the box, the size of the place where you put in the paper should be very small. Like it should just be enough to fit in the paper, not hand, so that you avoid, just in case maybe it fills up, someone should not be able to put in their hand and remove anything. Even considering, especially schools, children have smaller hands than adults, so you should also consider that. So the size should be customized as per that. And then, of course, even in these public places like the health clinics or these child-friendly spaces, it's important to provide a pen and paper, because that could be a hamper to just collecting the feedback. It could be something very small. Maybe they've just forgotten it. Maybe they actually wrote it down, but they forgot the piece of paper at home, or they were running an errand and forgot it somewhere, or maybe it got lost on the way. So it's important to have them on hand somewhere. Even for the school, it's important. Of course, in the school, it's a little bit easier to get pen and paper, but for these other facilities, it's important to think of this. And then, or have a place handy where they know where they can collect that pen and paper, but not somewhere where they have to go and ask. Because again, remember, they don't want to feel that they can be, like they can be identified as they came to receive, to pick this paper. So they're the ones who wrote this concern, so they can be identified. Okay. I think then we can get into the strengths and weaknesses. So some of the strengths that feedback and concerns can be shared at any time. For the facilities such as like schools and health clinics, which may be closed, of course, this is only limited to the times when they're open. But of course, this is now usually used by staff members or members of, for example, the school, it's usually by the staff members and by children. So they already understand the timings of the school. For the health clinics, health facilities, some of them are also closed at certain hours, and those also, this is public knowledge. So for maybe child-friendly spaces or women-friendly spaces, some of them are open at all times, so they can always receive this feedback at any time. They can always drop this feedback at any time. There's anonymity in that you don't have to write your name or number or anything that identifies you, or maybe your address. And in terms of handwriting in these public areas, it's not, no one could know your handwriting. And also you could always outsource someone to write an issue for you if you feel safe. So that means that, for example, if I have an issue, I can tell my sister to write for me the issue, and then I can go and drop it down. So someone may not know that it's me particularly they cannot identify me through the issue, through the paper. And then it also allows for open and predictable feedback to be received. So again, it's just an avenue to receive any sort of feedback, whether it's programmatic or just general feedback on issues in the community, personal issues which you may be facing, or someone else that could be facing, because it's unlimited. You can also support someone, maybe someone who feels that they should not report on something, but you feel that it's important that this issue is raised. You can always report on this. And then it's also free to use, as long as there's a pen and paper provided. Of course, as I've mentioned, it's important to provide this, especially in those open and public places where it's good to not assume that anyone can have access to a pen and paper. And when you're putting the paper down, it doesn't have to be like an A4 sheet. You can always put in like the small pieces of paper. So these are materials that should be supplied essentially by the organization, but they can have them on standby at the at this area. So whether maybe there's a school, they've already provided like a number of rolls of paper. So you should put just a few at a time. Of course, don't put everything, because there's sometimes people just take advantage and just steal those. You can use pens, which maybe you just tie it to somewhere where someone cannot take it. Or sometimes it's also important to just have the trust and just leave the pen and paper there, and you can always observe and see if there's usage, if there's reduced usage, or maybe if there's always people taking the paper but the correspondences are not they're not matching. So maybe they could be, the papers have gone but there are no feedback. It could be either people are using it for different purposes, or maybe someone has actually stacked up their issues and maybe they don't feel safe enough to drop them in that particular feedback box. Maybe they are going to another facility or another area to put those the papers that they've written down. So in terms of weaknesses, of course, one, it depends on the ability of people to read and write. This is a big one, because I may only feel safe if I write down my issue myself. Again, as I've given just an example now, I could tell my sister to write it down for me, but if I cannot read and write, they could write the wrong thing. They could write it could be misconstrued, or something could be lost in translation as well. And then also remember, the reading and writing also of the staff member. It depends now the language that it's written. Something could be lost again in translation if it's a different language that they may not be familiar with. They may also not understand really the gravity of the situation from how it's expressed on paper. Then secondly, unless the name and contact details are written, it's difficult to have a personal follow-up on these issues. So of course, we say that it's an anonymous way to provide feedback, but it would be good to also always have the follow-up in person with the person who has given the feedback, but this is not always possible. And then there's always the risk of also having people observing you when you're using the feedback box, as I've mentioned, because now this really makes you not want to use that particular one. As I've given also another example, maybe you could be a student, but you may decide not to use the feedback box at school, but rather go to the hospital or the health facility and use that feedback box to drop in the feedback that you've written, because you have that fear of someone seeing you, or just that risk of victimization, or something could endanger you at that time. That also especially applies to children in the schools. Then always emptying the boxes is a resource intensive activity, especially in remote areas, because this means that you always have to have vehicles to take the staff around to collect all these notes. And then, this is also maybe a daily thing or every other day. That means that the staff has to be really dedicated on this particular activity. And there could be maybe times when they're not able to travel because of issues of either mobility, transport, or even sometimes it could be really remote. And so that means that it's time consumed and they could not maybe reach all the facilities in one day. So that means that it's also a continuous process. So every day, maybe they're going to different facilities to collect this feedback. Okay, so lastly, we'll discuss focus group discussions today. So just to highlight, because this is something that we've covered before, and you can go back to the data collection YouTube on which has focus group discussions among other types of data collection. So it's more or less the same. So this is particularly now for adults that we are talking about. So it seeks feedback on activities, items or services, or even staff behavior. Normally it involves about 5 to 10 participants at a maximum. A good number is usually 6 to 8. because that's a number where you can be able to listen to everybody effectively and be able to also, provide feedback as you go on, be able to interact with them. And then secondly, it's gender segregated. So you should have male focus group discussions, which is also facilitated by a man, and then separately a female a focus group discussion, which is facilitated by a woman, because mainly in the communities, in these vulnerable and marginalized communities, there are issues that are, more faced by women, and they feel that maybe they may not open up completely when the males are there, because remember, in the society, that's how they live, but they may not feel that they can give that feedback if they're still in the same, they're put in together. And there's always that fear of, these people may not understand them, and also that this message may get back to their husbands, their spouses, or any other of their relatives, and they may not feel that they can open up and be vulnerable about the situation, especially even when it comes to issues which are happening in the household. They could be undergoing gender-based violence, or any type of issue. And then if they're facilitated by NGO staff, and they also use a guideline of a set of questions, but they're not run like a question and answer. It's more of a discussion. So also to note this, it's usually a smaller number of participants than community meetings, which we'll cover in the next part. But it's also a better way of discussing topics in depth, because these community members, community meetings, will see that, they involve anyone in the community member. They have representatives of different stakeholders in the community. And most of the times they're also dominated by certain, elders or leaders in the community. So you're not really able to address certain issues, especially as the NGO person who is facilitating this exercise. So in terms of strengths for the FGDs, it's suitable for those with lower literacy levels, and also visually impaired people, because all they need to do is come and discuss. So they only need to just elaborate what are their issues that they're facing, any concerns that they have on the project, or even externally. Then it also allows for a preferred, verbal face-to-face approach, where people are able to open up a little bit more and have like they clarify issues, and you're able to understand issues a little bit more in depth as the NGO staff. And then at the same time, you can still provide detailed feedback on specific activities, especially where what are the solutions or what is being done and when, in terms of timeline, so that you also limit the expectations and for people to understand the project or program better. It's also an opportunity for the community members to ask more questions, and even the NGO staff can ask more questions during the discussions, and then you can get also immediate answers, because remember, we are also trying to be integrated in this community, especially where it's a new project or a program. So that means that we also want to understand, for example, if it's an issue when we are discussing issues on education for children, maybe adolescent children, and there's been high dropout rates. So it's good to understand, maybe is this different for the different genders? Maybe the women will tell you that the girls are dropping out because of early marriages and pregnancies, but maybe the male FGD will say that, we are trying to force our children to stay in school, but they prefer also to drop out and get married and start their own families. So it's important to also to clarify some of these cultural and contextual issues through these forums. And then, of course, it also helps to elaborate some quantitative trends, because we could have collected some surveys, could be household surveys, or even using other data that is quantitative But this being a qualitative discussion, focus group discussion, you're able to in-depth and understand some subjective issues or issues which have come up in terms of trends or things which are outliers as well. Then lastly, this face-to-face interaction helps to build trust, and the community is able to share more sensitive feedback once they feel comfortable and once they feel heard and listened to. They feel that this is now going to be a safe mechanism to handle complaints which they may have or any other issues and concerns. Lastly, for the weaknesses of focus group discussions, it limits those with mobility issues because they're not physically able to come to where these focus groups are held. Essentially, they should be held, places where it's accessible for the community members, and they shouldn't have to walk very far, especially when you're doing a program in a very, in a locality where you've sampled maybe a certain village. So you should be able to make sure that it's not too far from the household, especially knowing the context and knowing maybe there are quite a number of people with mobility challenges. It's important to keep that in mind, but overall it's a little bit unsuitable because remember, these vulnerable people may not have wheelchairs or crutches to assist them to come to that distance. So they may need someone to carry them or transport them in one way or another. The other weakness is that adults may not feel comfortable to share concerns with a stranger. So the facilitator may be someone who they do not know. And also this could be the first time interacting. So it could work in either way. So sometimes they may not feel that they can tell you this information, but on the other hand, they may feel that a stranger is better for them to talk to and address their issues. But it's a risk. And then thirdly, because there are limited participants, as we've said, because you need to be able to control the group, it could create some feelings of exclusion in the community, because if some people may feel like, oh, I was supposed to be part of the group, why wasn't I called? Because maybe my neighbor was called, or my sister, or my relative, but I feel that maybe my issue was not raised, even though it could have been representative, but there are always those feelings which may arise in the people. So it's important, even when you're selecting this group, that it's representative. Of course, it depends on also the type of project and the type of feedback that you want to seek. So that will speak to the sample in terms of maybe the age and the different diversity in terms of maybe the literacy levels, or if, for example, these are pregnant and lactating women, there are different age groups, the ages of their children. So this should be really narrowed down, and you should be able to identify these people. It should be random. It shouldn't be that these people. Of course, you have already the criteria, so you're purposive, but still random in that the persons who have been selected may not necessarily be, let's say, part of one family. They should be part of that village, but different households. And then it's necessary to run the separate FGDs for men and women, as we've mentioned, so that you're able to elicit the different responses as per the gender. But this again requires more human resources. You require at least two people for each. So you require a facilitator and a note taker. So you require actually 4 people, if possible. Sometimes you can do it by one person, but it's good to have 2 people per group. So in a female group, have two female facilitators. One can ask the questions, and then one can be the note taker. And you can always interchange this. Even the note taker can still ask more probing questions or seek for clarifications, but they can support each other. And, just in case one is not able maybe to, sometimes things happen, maybe one may not feel well. So it's important to always have that contingency as well. But that is a factor of a human resource as well. Then there's always the risk again of powerful members of the community to dominate the FGDs, just as the community meetings that I've just mentioned. So that means that some people may have their opinion be the one which is more pronounced, and then the people who are maybe a little bit more reserved may not speak up, but it's up to the facilitator to be able to mitigate this and be able to allow for each person to actually speak. Not each person may speak, each person may not speak to each question, but there should be active participation, and you can probe those who are a little bit more silent so that you make sure that it's equal and you can hear the different perceptions, especially now when you've profiled the people with different criteria. It's really important to have the outlooks of different stakeholders to speak up. And then we have that this channel is also limited to be used only when the NGO organizes this focus group discussions. So of course, this is resource intensive, so that means that it may not occur very often. And so it's just limited to when it's arranged by the organization. And it's also important to have the community to have that awareness of why it's taking place at the time that it's taking place, and what the information is going to be used for. Just as we mentioned in the data collection phase, that it should be voluntary and the people should understand the purposes, and also, you know, it's a form of feedback. So they have the power, they have the voice, they can say no, and they can also hold the NGO accountable to whether they are going to actually use this information to make their program better quality or more effective and efficient. Then we have this channel is also, it requires staff to be trained. As I've mentioned, you need to balance that participation. So they need to understand how to make sure that everyone participates, also inclusion and facilitation techniques, so that it's effective at every sitting, so that, you know, you don't have to repeat. For example, if maybe you feel that there were some FGDs that were dominated by certain persons and you feel that you need to repeat, this is also resource intensive. And remember also, you're pulling people away from their day-to-day income generating activities, or even, you know, activities that they had planned to do. And it's important to be respectful of that. So lastly, these focus group discussions may be unsuitable for sharing some sensitive issues due to embarrassment or stigma. So that means that you may not go into very high in-depth detail about some issues, such as especially gender-based violence, which could be personalized to one person or even two. But you know, it's an avenue of feedback, so you need to just make sure that there's more avenues which are used, or more channels that are used, that can be able to accommodate this sensitive feedback. I think that's it from me. We can move into the Q&A. Back to you, Eric.
Thank you, Winnie, for that session. Thank you for guiding us. And yes, we can move on to the Q&A. I can see a few questions. And I still urge our participants to keep on sending their questions to the Q&A section of the chat. Let us avoid the chat, because there's so much information, and we do not want your question to be overlapped. So if you have any question or query, kindly send it to the Q&A. Winnie, I don't know if you're there with me.
Yes, I'm here, Eric.
You can guide us through.
Okay, and let's go through the Q&A section first, and then we can have some people to unmute as well. So we have Kem Tan is asking, based on your experiences, did you receive a lot of feedback from people through feedback box? What are the motivational factors of people to give their feedback through the feedback box? Based on my experience, sometimes it has worked, sometimes it has not worked. Interestingly, the context where it's worked best in my experience is a area where there was low literacy rates. And the motivating factors, I can't mention all. I think the main one, which came out really strongly, was people really felt that anonymity was very highly valued, and they felt very safe using this mechanism. The other channels which were there was a hotline, and there was a help desk, but it was not very active. So I could say also there was limited channel, but really it was very interesting that the feedback channel was very highly used. And what we gathered was that people could use their relatives who had like higher literacy levels. So this feedback was really gotten mainly from people who are a little bit older in the society, in those marginalized areas, but they had children who had grandchildren actually, who had gone to school or had at least some basic level of literacy. So they were able to write this feedback for them, and it was well answered, and they felt that they could trust this particular channel. Okay, then your second question was on, can you explain more or give a specific example in terms of reduction of harm to community, including children, and what are the strategies to reduce or eliminate the harm? Yeah, so I mentioned this as part of my slide on, I just want to go back and say it correctly. Yeah, this is why we should have a feedback and response mechanism. So that means that once we collect the feedback, we are able to reduce the chances of this harm being inflicted to the community members. So one key example is on sexual abuse or physical abuse to children or to anyone in this society. The main emphasis there was children, just because we need to make sure that the feedback is being sought for anyone in the community. So once we receive, like an NGO receives feedback on abuse that is going on through any channel, we are able to refer this to the stakeholders who actually deal with this abuse, and these people are able to be reported, whether it's actually other authorities, not necessarily NGOs. It could be government authorities, health authorities. We are able to reduce this. It could not be completely eliminated. That's why I use the term reduce, because we are able to at least address, and these perpetrators are held accountable. So whatever action is also, based on the community, based on different procedures, but seeing that we are able to have a channel where this is communicated, we can reduce this type of harm. Okay, we have Opoka. James P. Legal is asking, during FGD, is it possible that the participants can discuss the same issue, I think it's the same issue, among themselves and give the conclusion they came up with? Okay, so during the FGD, so the main role of the NGO facilitator or NGO staff is to guide the discussion. They can discuss the issue among themselves, but the point is you're seeking the feedback, not necessarily asking them for support. It could be an opportunity for them to actually come up with a solution themselves, which is great. But then there's a risk of that particular item being discussed for longer than you have time for, because remember, it's important to also keep in mind the time that you're holding these people for. They have their other issues to attend. So if it comes up, if it's a natural way that they're communicating, that's okay. But remember, this is also a sample of the population. This is not everybody, and that means it could be applicable, but it's important to have this, you still record this as a way in which you can communicate to the community that they can also address their issues. It's a learning for the organization, which can be noted. So this can come up, just be aware of the time of the time. Then we have Gat Bell Chani is asking, in establishing a suggestion boxes, the issue of confidentiality and accessibility seems a bit to put in person in a dilemma, because keeping the confidentiality may mean hiding the boxes, which will make inaccessible. What's the best way to balance these two? Okay, confidentiality and accessibility. Yeah, thank you for your question. It's a difficult balance. I think, as I mentioned, it's important to make sure this place is not completely public, but at the same time, it should be accessible and confidential. But I think at the end of the day, what matters is the information and how you are able to feedback these complaints that you receive. You know, once someone gives you a complaint or any feedback and you're able to address it without the person feeling that it's there's some fear of them being sourced out and actually it's no longer confidential, they're not able to trust that mechanism again. So it's a matter of when you before you set up, of course, you have to do some groundwork. You have to, ask if it's in a school setup, maybe they already have the suggestion boxes, maybe it's not been working well for them. So find out what has been there in place first in terms of the channel of communication, because it could be even a matter of the suggestion boxes will not even be used. And so even if you put them in an accessible and confidential place, they still could not be used. So find out what is the way that they have been getting the feedback, and then you can work with that from there. And also it's also a matter of, because this is a portable box, you can always find a way to change it. Of course, you shouldn't change it like every so often, but if it's not working, if you give it a duration of like 6 months, enough time, you can always come back and evaluate and see what's really been the main issue. And also remember, there could be an area that is more accessible, or teachers feel a little bit more confidential, but students don't. So it could be appealing to teachers, but not to students. So there needs to be a balance, or you have like enough boxes that you can be able to have the two who are the main stakeholders, especially in a school. Yeah, so it's a difficult, but it's a case-to-case basis. There's no one size fits all. It's important to also just seek the feedback from the people who are going to be the users of these boxes. Okay, then Husseini Mohammed is asking, can there be a template to be used by beneficiaries for feedback purpose, or they use their own paper to write feedback on? Yes, it's there shouldn't be any guideline, because remember, we want to keep it open. Sometimes it's a complaint, sometimes it's a compliment, sometimes it's something not to do with the community. Sometimes it's just something that I'm feeling. So for example, like I'm a student and I'm feeling that the teacher doesn't listen to me, and that's it. And so if you put like a standard way or like questions for them to answer, it limits. Sometimes, honestly, with this feedback, because it's subjective, it could work in maybe areas where there's high literacy rates and you want it to be very specific, and it's maybe just one issue that you really want to look at. So it's maybe not as broad as in a school. Maybe it's just a small area where maybe if you're doing a training, you could ask, what are the things you liked best, what are the things you didn't like. That's fine. But if it's like for a general basis, like a school or a health facility, just have a blank paper, because that also sparks someone to think about issues which they've never talked about before, which they could feel a little bit more safer if they write down. Okay, I hope that's clear. Then Abdi Yassin Ahmed is asking, how can we encourage privacy for rape cases in close family members? How can we encourage privacy for rape cases in close family? Okay, so when they're seeking the feedback, or they're coming to us with this feedback, there are times when they could come alone. There there's always that fear that they may not give the complete authentic information and they could try to cover up their family members for this. That's always a risk, and there's not much we can do about that update. But the most important thing, I think, as I mentioned, is to make sure that the people would feel very comfortable when they come to us. And that means that, for example, if it's a female who has been raped, that a female is also helping her to calm down and to be able to speak about the ordeal. And so once they give the information, that's the only time that we can go ahead with doing the referral and addressing the situation, but we cannot jump in unless we know. So it's, I hope that makes sense, because we have to wait for that information to come from the victim, and then we can address it from there. But to for the privacy to be increased, it's only a matter of just assuring and reassuring and making sure that once you already have like a good rapport in the community in terms of trust and confidentiality when you're dealing with these other issues, your name a little speaks for itself, and especially if it's an organization that is also dealing with these things. Alternatively, it's also to suggest to any persons, not necessarily people who you may feel that have been undergoing abuse, to give them these other channels, like the hotlines, which are anonymous, and they can decide to make the calls at the time which they feel comfortable. As long as they have the information on the different channels, they're the ones to now, the ones which they feel more safe. Maybe they feel that it will be private and it will be handled on a one-on-one basis. They can now go ahead and report using those channels. Then we have Walu Abdu. He's asking, please can male staff go ahead to take part on FGD with female participants on the absence of female staff? Yes, they can. It's not that they cannot, it's only that it will be ideal if we have both female and male staff to facilitate, because there are issues which are really gender-based, like there are only certain, there are issues that are only limited to the female and the issues which are only limited to the male. And also in terms of just comfort and eliciting this feedback, making people feel more open and relaxed, it helps when they have their own gender there. You can also decide to just have an FGD for male at one time, and then when you have the female staff come, you can decide to now have that female FGD at a different time only with the female participants, if you're aware that the female is not there from the onset. But if you had already planned, then you'll have to just have both together, and depends on the human resource, of course, as well. Okay. Lamson Osira is a very good presentation. Meaning, can you briefly highlight the key pillars that make a safe FRM successful? Yes, I think we'll still continue in part 2. There's still some other feedback boxes, but the key ones which we've already captured today is just making sure that it's a safe and responsive mechanism, making sure it's accessible for all community members. Think about the different genders, think about the different vulnerabilities in terms of if it's a female-headed household, if they're widowers, if they're people with mobility issues. Those are the key highlights, but we'll also cover that in the next next session. Then we have Hosseini Mohammed is asking, can feedback box be instituted in a local NGO as a means of management approach, especially where staff feared that their opinions are not taken during staff meeting? Yes, of course, this is something that is used in organizations as well, but it should not be. I think here you want it to be particularly for staff who have not maybe taken part in the staff meeting, but it should be open. It should just be a mechanism where you receive any and every feedback, because you'll be shocked, because sometimes even through the suggestion boxes, even in my experience, there's been very sensitive issues happening in staff offices that have been reported through those suggestion boxes. So it's also a matter of, I'm not sure if you were talking about the community or just the staff, but if it's for the staff, yes, it can work. And it's important to, again, make sure this information is very clear. During staff meetings, you can have emails, chains which are sent out with the information on how to give feedback, have the different lines as well. Because remember, even the staff members are also community members most of the time, if they're not external. And so they should also be open, feel safe to use these mechanisms. Okay, lastly, we have Ali Hassa is asking, community complaint committee, can we be able to use as FRM in project? Yes, that's also one of the feedback ways you can use for feedback. So you can, when you're starting your project, it's important to start this committee as well. So call it feedback, maybe not complaint, but for the people to understand also that it's any feedback should be channeled through them, but also make sure that this committee is also made up of the different groups in that community, so that people feel represented. So for example, if it's like a lot of female-headed households, there should be females in that committee. There should be like a youth member, people who are also approachable, so that you're able to, they can actually solicit for this feedback from the project. So make sure it's holistic, and make sure these are people also who are active in the society, and they can, they're approachable, they can go around at any time and people can come to them. And they also should be trained as well on how to facilitate this feedback, and they should be able to make sure that it's also confidential and anonymous, and they record it and channel it back to the project, because this is part of, those are like quality issues which the NGO needs to also check on, and even check on their project effectiveness as per the complaints which are brought forward. Okay, then Ali has said something again. I have questions related meal. One, how to develop a meal plan in the project, how to save the project data. Okay, I think for this, maybe we won't cover this in this particular session, but I think my colleagues Eric and Anthony have talked about, there's another platform that we'll talk about different questions. For now, we are tackling just these ones on the complaints and feedback. Then, so you can channel it there, Ali Hassa. Then Michael Lege is asking, thank you, Winnie, for the excellent presentation. Could you share your insights about the opportunities and threats to project management when they receive feedback from the beneficiaries? Okay, opportunities and threats. Yeah, definitely. The first opportunity is, it's an opportunity for the project to be more aligned as to what is needed in the community. If you're able to have resources to actually cater to these issues. I think that's the key one. I can't speak to all right now just because of time, but that's the key one. And then in terms of threats, there are definitely very many risks in terms of, even the organization could receive a lot of negative comments on issues that the community needs support, but they do not understand that the scope of work is already limited to certain projects or program outcomes, which I'm sure you may understand as per the log frames and indicators. So, there could be a threat of also mistrust, because people may have this negative feedback, and that leads to people not wanting to even give more feedback, or people who are reluctant to even participate in the project. But it's a matter of proper planning. And for me, I feel that information is very key. It's important to always give people the information beforehand. So even when you're planning for this project, make sure that you have community participation, and even their input is very important in terms of what they would like to be done in their community, how they would like to support, and what type of support they need, how long they need, because they already have this information. They are in need, but they know, they have some sort of knowledge. So that reduces the threats especially. And the opportunities also could be very varied, but it's definitely an opportunity to work better, and even for future projects to work better, especially if you're working in the same context Okay, Ibrahim Ahmed is asking what is the best forms in which you collect FGD data and make a report. For FGD data, you have to collect the information, like have an actual discussion. Face-to-face is preferable. In my experience, I've done both online and physical FGDs. Definitely online has its some people could be preoccupied doing other things. So sometimes you're not eliciting really the full feedback of the person. So it's best to do it face to face, have like an inclusive team of people. So have, if it's 5 to 10 or about 8, maybe at most, then collect that data. If it would be good if you also record it, if you're able to. If not, it's important to capture all this information by taking notes. And then from there, I would stress that do not only use this as your sole channel for feedback, triangulate it with other channels. So if you receive similar feedback from maybe the hotline or the help desk, it will be good to see so that you can actually see a clear picture. Because as I've mentioned, the people in the FGD are maybe 5 to 6. That's only in 5 to 8. So that's only a representative of the community. There could be greater issues which have been shared through the other channels, which you may miss out on. So after that, triangulate it. And then for this particular, I'm not sure if you're talking about a general report or a feedback report, but you can use this for just a meal report and see, what are the trends, like what are the main issues that are coming up. This also the people solution oriented. Are there issues of like, are people, what are the things which are coming, the themes which are coming out? Like, is it like child issues? Is it issues to do with education? What are the key gaps? Is the project really aligning to the issues that these people are speaking of? So that's what your report should be. So based on the findings, and then you can give like some recommendations on what else needs to be done as per what you've received in the feedback. But it's very important to make sure that you've triangulated this. Okay.
Winnie, just due to time,
Yes.
and also to allow our participants to ask questions, maybe you can take the last question.
Okay, no problem.
Okay.
And Andrew Gallo is asking, thanks for the presentation. What is the best way for an organization to give feedback to the community surrounding their complaints? Okay, I think as I've mentioned this, it needs to be adapted. So there's not one size fits all. You need to adapt this to how the community feels that they can also give you the feedback. So sometimes you may be surprised about what works best or what is asked for and the accessibility of this. Okay, I think Eric, we can move on to the live ones.
That is okay. And so at this time, we will allow you, our participants, to ask questions. To do that, you can simply raise your hands, and I will allow you to unmute your microphone. And I can see a few hands are raised at the moment. I can see Angela Mwale. Angela, are you there with us? Angela Mwale?
Yes, I'm here, but I don't have a question. I just appreciate the presentation and everything that is highlighted.
Oh, okay, that's okay. Thank you for that. I can see Saud Elmi Hussein. Are you there with us, Elmi? Elmi Hussein, are you there with us? You may unmute your microphone. Maybe as we wait for Elmi, I can see Charles Taban. Taban, are you there with us?
Yeah, I can hear you.
Yes, you may proceed to ask your question, Taban.
Yeah, thank you. Mine is not necessarily a question. I think thanks to Winnie and also appreciation to Global Humanitarian Institute for the novel work that you're doing. In terms of the the feedback and response mechanism. Like Winnie said, I think one of the important aspects is the community-based accountability assessment, which will make the choice of feedback channels and complaints to be evidence-based, because as we write the project design, we may not impose in terms of channels that are going to be used in the community. So it implies that we have to get down to the community and conduct the community-based accountability assessment, where the community will tell us, based on the context, which channels are available for them to use. For instance, in South Sudan, you find that the use of suggestion box is very difficult because most people are not able to read and write, unless you have a community accountability committees where they have someone that can write. And of course, like Winnie said, if someone else is writing, also the question of how about sensitive complaints? How is it going to be taken care of? So the CBBA is an important element. And on the feedback form, yes, there's a need to have a feedback form without necessarily question, but then the feedback form should be able to detail what is a complaint or what is the feedback that we're receiving, where is it coming from? For instance, if we have more than 2 projects, more than 3 projects, at the end of the day, the complaints and feedback that are coming should be pegged to the different projects. Is it from the education project? Is it from the health project? Is it from the child protection projects? And who is going to provide a response to this complaint? Is it our staff or is it our partner implementing staff? So the form also enable us to be able to track the number of feedback and complaints that we receive in a week or in a month, which can be then go down into our information management system. For instance, if we're using a database where we can track at the end of the day the projects that are, the feedback and complaints that are coming per each project. And of course, lastly, it should also, for feedback and response mechanism to work very well, there should be a culture that ensures a quality benchmark, for instance, community project information sharing, because for the community to participate in feedback and response mechanism, we should have shared the information about the project, we should have shared the information about expected behavior, and then before rolling out a project, there should be a launch of the project that bring different stakeholders where we share information related to the project, the role of the community, the rights, the entitlement of the community, and the service receivers in regards to the project. So I think this has been a very good refresher session for me. I like it. And of course, for some of my colleagues that have not taken courses with the Global Humanitarian Institute, I think you just need to, of course, as a student of this novel institute, I am happy about the programs that you're always designing. It is need-driven, it is context-specific, because it deals with the day-to-day issues that we encounter, mainly in the humanitarian arena. Thank you very much.
Thank you for that, Charles Taban. Thank you for also the good comment and the good feedback. Winnie, I don't know if you have anything more when it comes to what Tabana said.
No, I think, yeah, I'm in agreement. Thanks, Charles, for that. And definitely, yeah, just it's holistic and just making sure that we also understand and we give this information that we have to the community, and we, they are coming to us from a point of knowledge, of course, of holding us accountable. Yeah, thank you.
Thank you for that, Winnie. I can see more hands up. Franklin Kalembo, are you there with us? You may unmute your microphone. Franklin Kalembo, you may unmute your microphone, Franklin. Okay, as we wait for Franklin, I can see we have Mary Bada. Mary, are you there with us? You may unmute your microphone.
Hi, yes, I'm here.
Yes, Mary.
So my question was, though it was half answered, but my question was, can this exercise be used to inform a new project? Especially, we talked about special groups like persons with disabilities and their needs. So my question is, can this exercise also be used to analyze the needs of a new project or initiative? Thank you. Back to you.
Thanks, Mary, for your question. Yes, definitely this can be used as part of, it can inform what are the needs and the gaps in maybe like the present project, and then it can inform a follow-up project or the need for a new project, which could be specific to a specific community, community members who have not been reached by this. But other than the feedback mechanisms, it's important to still do a needs assessment once you already discover this. And then, as I've mentioned, it's still important to triangulate this information that you get, because sometimes it's only if, for example, this information has been gotten from a focus group discussion. We need to see if we have also received the same from hotlines. And then again, before delving into a new project, make sure that you do like a complete needs assessment of whereby you can get the population of this certain profile, maybe which has not been reached by the project due to some reasons, and then understand what has been the challenges, because sometimes it might not need a completely new project. Maybe you can just support by, there are various ways you can maybe give just goods in kind, or you can give money to a partner which is actually working in that particular sector after, highlighting this. And of course, you're coming from an informed point of evidence. I hope that's a little bit clearer.
Yes, thank you.
Thank you for that, Mary and Winnie. And you can still see a few more hands up. And ladies and gentlemen, due to time, you will allow me to take the final 3 questions. For any other question, I will be sharing a link to the communities where you can ask the questions. John Kasitomu, John, are you there with us?
Yes, thank you very much. Mine is just a compliment and emphasis. In the first place, thank you for the nice presentation. It has really explored all the areas, sensitive areas that makes CRM or FRM effective. But what, at least from my experience, I see as the most important area to look on is giving feedback. Otherwise, what I have been encountering is that yes, the beneficiaries are ably giving their concerns, positive ones, negative ones, and then for us now to give feedback to those concerns, I think it's been a challenge in many mechanisms. So if this really could be a wake-up call for us in humanitarian accountability partnership forums or projects, at least to help facilitate giving back the feedback to those that raised the concerns, and they really see an action taking place. If one is meant to be prosecuted, that should happen. If there is need maybe to modify the design of the projects, that must happen. That way, it will really be considered an effective mechanism. Otherwise, I've seen mostly the feedback part is not very much emphasized, which it's my appeal that should be emphasized. And then others feel challenged to, I think it's culturally that we are not able to express negative issues, negative things in a negative way. We are very much acquainted with always presenting what is negative and hiding what is what is positive. We are always acquainted in providing what is positive, and we very much hide or not to be associated with presenting that which is negative. This should also be something that should be looked into. At least the beneficiaries should be well sensitized, empowered to feel that they will raise their concerns, negative or positive, and they will not be retaliated upon. They will not receive any it will not have any bad repercussion after presenting their challenges. So 2 things: giving feedback, the beneficiaries to give those real negative challenges they are encountering in the project implementation. Thank you very much, and over.
Thank you for that comment and recommendation, John. Winnie, don't know if you have anything else to add on it.
Yeah, thanks, John. Actually, you've highlighted something very important, this closing the feedback loop. I mentioned it, but I think if organizations could also make sure you're also holding the mill staff accountable. So where you have especially an MIS, a system where you actually record this feedback, it doesn't have to be complicated. It's just sometimes even just an Excel form, and you monitor the days that it takes to close the loop. And closing the loop means that you have collected the feedback, you have sent it to the person who is supposed to close that. So if it's like the child safeguarding person or the education officer, and then they have responded. So that is, they've responded back to the community member, especially where you already have the details. That's completely closing. So, having tracking that, sometimes it could be discouraging, but I feel that it makes sure that you can see, you can always monitor, because sometimes it's easy to record, but when you don't have the complete chain from the date of receiving the complaint up to the date when it's closed, you lose track. And when you don't especially have an accountability officer whose main work is that we just receive it and you don't close that loop. And as you've said, the community is not even informed on what was done, on whether it's a perpetrator, whether it's just even the compliment, to feel them, to make sure that they felt heard. Because as I keep on emphasizing, these are humans at the end of the day, just like me and you. You always feel good when someone comes back to you, tells you thank you, and the person receives that thank you. So yeah, thanks, John, for that.
Thank you, Winnie. I can see another hand up. Franklin Kalembo, are you there with us? Franklin Kalembo?
Yeah.
Yes, you can go ahead and ask your question.
I haven't any questions this moment.
Okay. Okay, Franklin, thank you. Linda Mwale, are you there with us? Linda, you may unmute your microphone. Okay, as we wait for Linda. Linda, are you there? Husseini Mohammed?
Yeah, hello.
Hello.
Thank you very much, Mr. Eric and Winnie, for this wonderful presentation. It has been an eye-opening for my humble self, who is just new in the meal system. And I want to ask a specific question on this feedback mechanism. For instance, in a district where the project implementation is taking place, and there is a feedback from a particular person, and the feedback is uncommon across the district. Perhaps the feedback may be looking towards influencing or shaping the project approach, but it is not common. Could this little frequency be basis for decision to influence the project approach? Thank you.
Husseini, I'm not sure if I've gotten your question very clearly. Are you asking if the feedback channel is not common and it's what is the project is wants to be used?
Okay, my question is, feedback channel is common, but the person, there is an issue, a concern raised about the project from the community. And this concern raised is not common among all other beneficiaries. It could be that among 250 beneficiaries, only one person have raised a concern, and this concern have a potential to influence the project activities. So I want to know the frequency or occurrence of a particular concern raised before it can be treated.
Well, yes and no. So it depends on the issue. So of course, sensitive issues are taken on a case-by-case basis. So if it's an issue of, there are times issues of cash diversion, which is it's only you maybe who your cash maybe was diverted to, or you didn't receive the cash which you were supposed to receive, or maybe it's an abuse issue that is only, it could only be reported by you because you're the only victim of that. And that is okay. It's an issue which should be looked into as how do you say, like we could investigate only your case, but that does not necessarily mean that now you change the whole project because of that one particular feedback. Once there's like an investigation which is conducted to find out what exactly maybe caused the issue. So let me give the example of the cash. So for example, if you are supposed to receive cash through a certain agent, but this agent maybe diverted the cash and you only received maybe 20% of the cash, that could be an issue with that agent and also like the modality of giving the cash. It might not mean that we now completely eradicate that issue of cash giving, but then it's an investigation which is conducted, and there are always disciplinary actions that have already been put in place. So those are usually called standard operating procedures by the organization, essentially. So there are very elements to this, but also is it direct implementation? Is it implementation through partners? So all this needs to be investigated before now we come to our conclusion, and then from there we can see if there's a high risk of this also recurring, or this recurring to one, to the person, the same victim, or two, to other victims and a wider group. Then that means that we need to think about contingency options to this. But definitely to inform a project change, it's not immediate just from that one feedback or complaints, receiving that complaint. We need to just investigate and maybe do a lot of due diligence about it. And also understand also, because there are times when people also lie, there's also that risk. And maybe the person even didn't really go through whatever he or she is saying. It could be just something that they've made up. But of course, we have to trust what they say and then do our investigations and then see, what is the risk of this recurring? What is the risk of this going uncaptured or without being responded to? So it's a holistic approach to it. I hope that answers your question.
Yes, very well. Thank you for your kind questions. That's done a lot. Thank you.
You're welcome.
Thank you for that, Husseini. I can see Linda Mwale. Linda, are you there with us?
Yes, I'm here.
Yes, you may proceed to ask your question.
Hello, can you hear me?
Yes, I can hear you, Linda.
Oh yes, my question is just simple. First of all, I should appreciate for the presentation. It was loud and clear. But then I have some few questions or just a clarification. Or I just want to learn from Winnie. We have learned a number of types of FRM. So I just want to learn from her, like which one is the best for the humanitarian program among the types of FRM. Over.
Hi, thanks, Linda, for your question. I'd like to emphasize that there's no one size fits all, because remember, even now as we are in this webinar, we are all coming from different contexts. We have, you're all responding in different areas. So that means that we should not assume that one channel may work for everyone. So just because, for example, you may assume that because maybe your context, there's 100% literacy levels, and so you assume that people can always write their feedback down, but they may not feel safe. They may not feel that they can trust that, or they may not even access that channel. And so that's why when we started, I think also Charles Taban also said the same thing. It's important to have the community participate even from the beginning, have a committee to empower the people, so that first they know that they should hold you accountable. They can and should give you feedback in any form. So it could be positive or negative. It could be a complaint, a concern, or a question. And then from there, they can tell you, or even if they don't explicitly tell you, you can learn maybe the way in which they usually express themselves better. So for example, if there are places where the face-to-face is more preferred, so that means that you need to make sure you have like help desks, or staff can come, community members can come to staff offices, the project offices, and they can easily access Amil staff and tell them their issues. And then from there, maybe you can also put in the others, because there's no channel that will suit 100% of the population. Because as I went through, you could see there are some issues of mobility with some of the mechanisms, and some others, have issues that you have to have like a telephone. Maybe some don't have a telephone. So it really just depends on the context, and you have to learn your context, understand what they need and how they can be supported, and then even learn from them what can work best, and then use that approach. And then you can always keep on adding. Maybe you can start with a suggestion box, and then have like the national hotline if there is one. And then now you can narrow it down to now maybe a hotline for the organization after you set it up. Because remember, also it depends on your resources. We can say that this is the best channel, but maybe you don't have resources for that. But always still interact with the community. So keep in place like those focus group discussions, those committee meetings, the community meetings, keep them in place even when you have all these other things. Because these are also channels to keep the participation and the rapport to continue with the community. I hope that's helpful. Linda?
Thank you.
Okay.
Thank you. Yeah,
you're welcome.
Thank you for that, Linda and Winnie. And due to time, we will allow us to close. For anybody who has a question that we have not answered, we have shared the link for the communities, and the link for the community and the forums on the chat section. You can always log in, create an account, and post your question there. And our team is going to be answering all your questions from that point. This moment, I'd like to thank each and every one of you for joining us this afternoon or this morning, depending on where you're from. And we hope that you had a wonderful session, a beneficial session. And we also do hope that we shall see you in the next session. From us here at Humanitarian Global, we would like to wish you a good day and a lovely day as well. Thank you.
Monitoring and evaluation have been considered to be an essential component of project management. As project management continues to evolve, there is need to incorporate stakeholder participation, information sharing, learning, accountability, and organizational transparency. To address the inadequacies of the previous M&E framework, MEAL course has been developed to incorporate these accountability and learning aspects. Undertaking a postgraduate diploma in MEAL prepared by Humanitarian Global will help the learner develop an in-depth knowledge and understanding of evaluation designs. In this module, you will get to learn more about experimental design, quasi-experimental design, non-experimental designs and comparison matrix. Secondly, evaluation approaches. The second module aims at covering various evaluation approaches such as feminist evaluation, transformative evaluation, real-world evaluation and realist evaluation, equity-focused evaluation and developmental approach to evaluation. Thirdly, preparing for an evaluation. The third module details all the steps involved in preparation for an evaluation by helping the learner to understand the initial steps, construction of theory of change, development of results chain and specification of questions. Also, you learn more about impact evaluation. In this fourth module, get to learn more about evidence-based policymaking, what impact evaluation is, prospective against retrospective impact evaluation and efficacy studies and effectiveness studies, deciding whether to carry out an impact evaluation. In addition, you will learn about causal inference and counterfactuals. In this module, the learner will get to study more about causal inference, the counterfactual, estimating the counterfactual, and 2 counterfeit estimates of the counterfactual. Our sixth module is instrumental variable. This module offers more understanding on how to evaluate programs when there is no compliance, types of impact estimates, imperfect compliance and the randomized promotion as an instrumental variable. The seventh module covers the difference in differences. This module will focus on teaching the participant on how to evaluate a program when the rule of assignment is less clear, the difference in difference method and how helpful it is, as well as understanding its limitations. Lastly, you learn about matching. In this final module, you will get to learn more about constructing an artificial comparison group, propensity score matching, combining matching with other methods, and limitations of the matching method. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.